Autism spectrum disorder, or ASD, is a group of neurodevelopmental disorders that are characterized by difficulties in social communication as well as the presence of very specific interests and repetitive behaviors. While it is most commonly associated with children and youth, ASD lasts a lifetime and can even remain undiagnosed into adulthood. Since there are no known biomarkers for ASD, diagnosis relies on behavioral observations. Most commonly, diagnosis of ASD is based off of the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, also known as the DSM-5. In order to be diagnosed, the person must have shown a specific set of symptoms. They must show all symptoms in the social communication and interaction domain, which includes difficulties reciprocating social or emotional interaction, difficulties maintaining relationships, and nonverbal communication difficulties. They must also show 2 of the 4 symptoms in the restrictive and repetitive behavior domain, which includes stereotyped and repetitive speech, excessive adherence to routines, hypo or hyperreactivity to sensory input, and highly restricted interests. The International Classification of Diseases, 10th edition, or the ICD-10-R, and the Autism Spectrum Quotient are very similar diagnostic tools to DSM-5. In general, diagnostic materials are more geared towards children, which makes it difficult to accurately diagnose ASD in adults. The Autism Spectrum Quotient is a fairly new self-report questionnaire that assesses ASD-like symptoms in adults. It can then be used and discussed with healthcare professionals in order to make a diagnosis. However, more research needs to be done in order to determine the accuracy of this tool. Some of the more common symptoms in adults can include difficulties maintaining conversations, difficulties understanding another person's point of view, little or inconsistent eye contact, sensitivity to sensory inputs, and sleep disturbances. There are numerous effective intervention options for adults living with ASD. Pharmacological interventions can be effective for some individuals and can include sleep aids as well as medications to assist with anxiety or other co-occurring mental health conditions. Medications are accompanied by therapies and can include many different types. Therapeutic options include psychological therapy to help treat co-occurring mental health difficulties, and educational therapies to learn essential life skills and promote a healthy lifestyle. The most common intervention is behavioral therapy, with applied behavior analysis, also known as ABA, being the most common. The goal of ABA is to develop functional skills such as vocational, personal or domestic, community, and leisure skills. While the symptoms of autism in children and adults are similar, living with autism in adulthood presents a different set of challenges than it does during childhood. Nearly half of people 25 years old with autism have never held a paying job. Approximately 1% of adults are diagnosed with ASD. 44% of adults diagnosed with ASD through the ICD-10-R do not meet the DSM-5 criteria. In Canada, the average yearly cost of supporting a person with ASD can range from $26,000 to $130,000. For more information, please visit yourlearner.com.